Welcome to the AHCCCS Non-Emergency Medical Transportation Reminders Training. Materials are designed for fee-for-service programs, including American Indian Health Program, TRBHAs, and Tribal ALTCS. The purpose of this training is to review important items with NEMT providers. Post-payment review. Arizona statute requires AHCCCS to conduct post-payment review of all claims and recoup any monies incorrectly paid. Under certain circumstances, AHCCCS may find it necessary to recoup money previously paid to a provider. Overpayments and incorrect payments are identified through reports, medical review, grievance and appeal decisions, internal audit review, and provider-initiated recoupments. Provider Participation Agreement. This agreement is made between AHCCCS and the provider in pursuit to Title 19 and Title 21 of the Social Security Act and Arizona revised statutes to govern the registration of and payment to the provider for the healthcare services provided by the provider to fee-for-service eligible persons who are not enrolled with a contractor who is providing member services under contract with AHCCCS contractor. The registration of and for the provider to deliver healthcare services to eligible persons who are enrolled with a contractor, and the registration of the provider who wishes to participate and qualify under the one-time only waiver option. Section B, General Terms and Conditions, in the Provider Participation Agreement, Section 5, the provider shall maintain all records relating to the performance of this agreement in the compliance with all specifications for record keeping established by AHCCCS. All books and records shall be maintained in such detail as to reflect each service provided and all other costs and expenses of whatever nature for which payment is made to the provider. Such material shall be subject to inspection, audit, or copying by the state, AHCCCS, the U.S. Department of Health and Human Services, and any other duly authorized representative of the state or federal government during normal business hours at the provider's principal place of business or where services to AHCCCS eligible persons were rendered. The AHCCCS Office of Inspector General reserves the right to request and secure original records from the provider at the provider's expense. AHCCCS OIG is responsible for maintaining and safeguarding the integrity of these records and will provide the provider with sufficient time to copy records for the provider's use at the provider's own expense. Section 8 of the General Terms and Conditions. The provider shall provide services, bill for services, accept payment, and otherwise be in compliance with all AHCCCS and/or contractor provider manuals and policy guidelines, including the AHCCCS minimum subcontract provision available at the AHCCCS public website and any amendments thereto, all of which are incorporated by referencing into this agreement. The provider has an affirmative obligation to routinely check the AHCCCS website for any revisions or new information and to ensure compliance. Provider Records and Registration, Chapter 3 of the Fee-for-Service Billing Manual. Per the PPA, providers must follow all AHCCCS guidelines, policy and manuals, including but not limited to the following: the AHCCCS Medical Policy Manual, AMPM, the AHCCCS Fee-for-Service Provider Billing Manual, AHCCCS Claim Clues, and Reporting Guidelines. Daily Trip Report Common Errors. Lack of disclosing employee name, employment begin date, employment end date, employee's date of birth, destination services not covered, and complete trip report. Missing required information on the letterhead in the upper left-hand corner, NEMT provider's name, access provider ID, company address, company phone number. Please note, using a stamp is acceptable. Missing driver's first and last name. It's not acceptable to only put the driver's initials, the driver's first name only, the driver's last name only. Facility name instead of an address under the pickup and drop-off section. This required information, an address must be included in some format. Lack of a formal street address is not a cause for no address to be listed. In the event that no address can be found, coordinates of a nearby landmark with the mileage from that landmark to the pickup drop-off location can be used. Missing member's access ID indicated under the access number field. The access ID number starts with an uppercase A, followed by 8 digits. This helps identify the member who received the services. Missing the reason for a visit. When transportation services are initially arranged, the transportation provider must obtain sufficient information to determine whether the transportation is occurring to an access covered service. This should be done prior to the transportation taking place. Destination service. Non-emergency medically necessary transportation is covered consistent with Arizona statute when furnished by non-emergency transportation providers to transport the member to and from a covered physical or behavioral health service. Medically necessary non-emergency transportation services are covered under the following conditions. The physical or behavioral health service for which the transportation is needed is a covered access service. If the member is not able to provide, secure, or pay for their own transportation and free transportation is not available, and the transportation is provided to and from the nearest appropriate access registered provider. In addition to the information on the previous slide, as of 7/1/18, non-emergency transportation services are covered under the following circumstances. To transport a member to obtain Medicare Part D covered prescriptions, to transport a member to participate in one of the local community-based support programs as identified in the member's service plan. Transportation covered to these programs is limited to transporting the member to the nearest program capable of meeting the member's need as identified on the member's service plan. Covered local community-based support programs are limited to the programs identified in the AMPM 310-BB Transportation Attachment A Community-Based Support Programs. Self-driving. No member may drive themselves and subsequently bill access. This includes the members driving themselves to an access approved cover service. To qualify for NEMT, free transportation service must be unavailable and an eligible person must be unable to arrange or pay for transportation. For an eligible persons driving themselves or able to arrange their own transportation is not reimbursable. Transporting family members. Transportation of a family member by a family member will not be reimbursable unless the transportation provider is an AHCCCS registered provider prior to the transportation and prior to seeking prior authorization if a prior authorization is required. If the family member who is an AHCCCS registered provider could reasonably be expected to provide transportation services to the member, such as a mother providing transportation to their child, then transportation would not be reimbursable. Transportation is only reimbursable if transportation services would otherwise be unavailable and an eligible person is unavailable to arrange or pay for the transportation. Questions can be directed to the DFSM Provider Education and Training Unit. Our email is providertrainingffs@azaccess.gov. The DFSM Provider Education and Training Unit can assist providers with the following: how to submit and status claims or prior authorizations requests through the AHCCCS Online Provider Program. AHCCCS includes American Indian Health Program, TRBHAs, and Tribal ALTCS. How to status a claim and prior authorization request through the AHCCCS Online Provider Portal for the fee-for-service programs, including American Indian Health Program, TRBHAs, and Tribal ALTCS. Submission of documentation using the Transaction Insight Portal. Examples include AHCCCS Daily Trip Report, requested medical documentation, etc. Additionally, the DFSM Education and Training Unit offers training with informational updates to program changes, system updates, and changes to the AHCCCS policy and AHCCCS guides and manuals. The DFSM Provider Education and Training Unit does not instruct providers on how to code or bill for a particular service. For additional information on rates and coding, please follow the below guidelines. The DFSM Provider Education and Training Team can be reached at providertrainingffs@azaccess.gov. Thank you for viewing our training video.